Thank you very much, Urvashi, and many thanks to Kinchi and Margaret for organizing this. I'm going to actually talk less about the hope. I think Anu and you will be talking about that much more, and a little bit more about laying out the context of the resilience that is required of Indian people and has been required over the past few years, and the reasons for protest and struggle, which we are now seeing emerging across the country. So I think it's important to mention these because, everywhere in the world, as Urvashi has said, we've had an extraordinary period. But because there has been a sort of tragedy and pandemic across the world, it's often easy to feel that it's broadly the same everywhere. And I want to emphasize that it's not. And it is also not because, the Indian experience, I don't want to get into a kind of disaster Olympics, as it's been called. I don't want to say ours is so much worse than everyone else's, except that it is. And the reason that we don't actually get a picture of how bad it is because, first of all, the international press, until recently, kind of played it down, also for geostrategic reasons, India being seen as a major ally of the West for various reasons, and because our own government has tended to repress or suppress data and information that would not give us the full extent of the catastrophe that is unfolding in our country. So let me just begin by highlighting that, if you look at the pre-existing conditions before the pandemic happened in the country, we were already a very, very weak economy. We already had a very weak economy with very poor health conditions. Our economy had been declining and the growth rate had been coming down progressively. It had even fallen to negative before the pandemic started. And investment rates had been coming down. Most of all, employment had been falling. And remember that employment falling in India is a huge thing. We don't have unemployment benefit, insurance, anything like that. 90% of our workers are informal. And so they have no choice but to be employed. Now, if that kind of employment is falling, it will tell you how depressed the economy was. This is, as I mentioned, all before the pandemic. And especially women workers. We already had a very low women's work participation rate for recognized employment of about 36%. It came down to 24% to 18%, according to the official surveys, which is one of the lowest in the world. And all of this, as I'm repeating again, is before the pandemic struck. In addition, we have a federal system. The central government is responsible for some things, but the state governments are responsible for pretty much all the things that affect people, affect our citizens, health, education, security, infrastructure, all kinds of things. And the central government is supposed to provide top-up, add-on. What we've experienced is a continuous centralization of the powers of the center, of the union government, and state governments being denied resources, which really means that they cannot provide these basic public services. They've had less and less ability to provide services and meet the basic needs of the people. And then we had, after a major election victory of the BJP in 2019, in May 2019, we had, in fact, and some very, very drastic moves on their part in terms of the overtaking of Kashmir and the denying of human rights in Kashmir, which continues to this day, to the bringing in of a very draconian act, which tries to effectively make Muslims second-class citizens. I'm sure Anu will tell you more about that. But because of that, we also had a groundswell of protest across the country. And this was especially in urban areas, but not only in urban areas. We had women's sit-ins, demonstrations of peaceful women, of students, of basically a complete explosion of protest that was becoming something that the government really could not control, and it could no longer even control the narrative. This is the context in which the COVID pandemic begins. Now, in some ways, the pandemic in its early phases was really a gift to the central government. It was a gift because the declaration that this is a serious kind of illness and disease, and it will spread very rapidly, that it is of epidemic proportions, allowed the government immediately to suppress all dissent, to remove all the hundreds of thousands of sit-in protesters in Delhi and in many other cities, and say, it's public health, you have to get up immediately. And everybody agreed, everybody obeyed. So it came as a kind of, gift that allowed the central government to disperse protesters immediately. But despite that, and despite all the indications, the government didn't really take it seriously. It used this announcement as a way of, as I said, suppressing the protests, but it didn't really take the actions that would be required to deal with the pandemic. The state government of Kerala is run by a left front government, and the health minister there from January had been saying that, look, this is a concern. We have to test the arrivals coming in from countries where there are infections. So beginning 24th January, this request was made, it was denied. The first cases occurred in Kerala, then there were also cases in Mumbai, in Bangalore, in Hyderabad, but they were still very few. The proposal made by several public health experts and by the Kerala state minister, as I mentioned, was that we must immediately start testing, tracing, and tracking all of those who are positive and then isolating them so that we can limit the spread of the disease, because it's still incipient, we can still control it. As I said, this was not done. There were some feeble attempts at, thermal checking at airports, which was really a joke. I'm sure all of you know about that in your own countries. And there was no attempt to actually monitor and separate those who were infected. We had, as a result, a significant expansion of the disease, but still it was not something so large compared to many other countries. Nonetheless, suddenly in late March, after the government has done lots of big rallies and done various things like destabilizing certain state governments and so on, the Prime Minister announces that there will be a nationwide lockdown. Nationwide. At that time, there were less than 500 cases in the country. And there were, I think, 10 deaths. So it was really not major. Remember, India is a country of 1.3 billion people. There were 500 cases, mostly in very specific areas. Instead of dealing with those specific areas, a nationwide brutal lockdown was imposed. I say brutal because it was like a curfew. It was like a military thing, and people were beaten up for being on the streets. People were arrested, and there was a very draconian imposition of this. And this actually made the economic condition of people unbelievably disastrous. Remember, there's no warning. You basically get, hardly 4 hours of warning to say that now, or maybe 1.5 days of warning. But public transport, all public transport was stopped. You had to just stay where you were. This meant that people were suddenly deprived of livelihoods without any planning, without any possibility of making their own arrangements. We have approximately anywhere between 150 and 250 million workers who come from rural areas to work in urban areas. Nobody knows the exact number. They were all told you cannot go home. You have to stay exactly where you are. Everybody has to be in situ, and you have to all do social distancing in your homes. Now, first of all, the term social distancing, I object to greatly. It's really physical distancing. It's really keeping a physical distance between you and others. But it's impossible in many parts of our country. 40% of the urban population live in slums, which are extremely congested. 5, 6 people to a room, sometimes 10 people to a room, tiny rooms next to each other, tenements where, you're really basically all on each other's backs all the time. You have no option. Water has to be collected. This notion of washing your hands frequently for 20 seconds each time. Water has to be collected. And even in rural areas, certainly, but even in many urban areas, you cannot store more than 2 or 3 buckets. So the idea that you can keep doing frequent hand washing is ridiculous. The idea of the physical distancing was completely unworkable for many people. And so that, just stay in your room, 7 of you in one room, and never step out. Originally for 21 days, then extended for another 2 weeks, then extended for another 2 weeks. It lasted for 12 weeks, this extreme lockdown, where you cannot go out and earn your livelihood. And most of our country does not have a huge amount of savings, does not have enough, put aside for them to be able to actually come out to rely on drawing down the savings. So you are talking about possible starvation of hundreds of millions of people. Now, not only was this a brutal lockdown, but then the complete closure of everything, which no other country did. You gave people notice, and then you closed down public transport after enabling people to actually get to wherever they would be during that period of lockdown. This is not the case in India. We made everybody suddenly stop wherever they were without any advance warning. And as I mentioned, with 90% informal workers, no legal or social protection. And then you provided nothing, really, almost nothing in terms of compensation. The total compensation provided, the total additional spending of the government of India in this whole period of the pandemic year, I don't even want to tell you, it is embarrassing to repeat it, 0.2% of GDP is the additional public spending. Now, the developed countries have spent 25% of GDP. Even the middle income countries, emerging markets, etc., between 4 and 6% of GDP. In our case, we have a large fiscal deficit, but that's because our tax revenues collapsed, not because we spent more. There was hardly any spending. There was a very pathetic attempt to give 500 rupees to only those women who had special accounts created by the Modi government a few years ago. And neither does that cover all the poor, nor do all the Jan Dhan account holders qualify as poor. So it was trivial, and it was meaningless, and it didn't really help. The only minor thing that was done was the provision of free food grain of 5 kilograms per person per month, first for 3 months, then extended until November. But this was only to ration card holders. And that is supposedly 80% of the population, but actually at least 100 million and probably 150 million people who deserve this access to food are denied it. But also all these migrant workers, the ration cards are based on residence. So the ration card would be with the family back home. They were unable to access any food. We had terrible stories of deprivation, of starvation, of extreme hunger, really terrible stories across generations, elderly people, working, able-bodied, working-age people, children. And we had, as I said, very, very little in terms of attempts to rectify it. In the first phase of the disease, the first lockdown phase, that's really, if you like, from April to July 2020, there were other attempts by state governments to provide some relief, community kitchens, things like that. Some attempts to provide relief because state governments put forward all their budgeted spending for the year, thinking that this is going to last for a few months. So let's spend whatever we can now to provide some support. That didn't last very long, but it provided something. But then, of course, as we know, the first wave, everybody thinks India handled the first wave very well. I would like to differ from that. And now that more data are coming out, we also realize that much of the indicators that people see to say that, well, actually India, it wasn't so bad and the mortality was not so bad. We are now getting the excess death numbers, and they're anywhere between 5 to 15 times what was reported. Now, excess death is a much better indication of the impact of COVID than the actual COVID-related deaths. We all know about how there's underreporting, the deaths are not classified as COVID deaths. In India, we know that at least 20–25% of deaths are never registered in the first place. It probably has gone up in this period. But even among the registered deaths, we are getting massive excess death data, which we now know occurred even in the first phase. So it was not so much of a better phase in that sense. Nonetheless, for reasons we don't know, that the virus tends to die down. There were lots of seropositivity indicators that suggested that, let's say, in Delhi and Mumbai, about almost 2/3 of the population had antibodies, which suggested that they had been infected at some point, but it was not as deadly. The second wave, as you know, was one that completely devastated the country, but I come back to the second wave. This collapse of livelihoods without social protection really meant that the migrants who were left in the cities without any source of income had no choice but to somehow try and get back home. Is there a problem? No. Okay. They had to somehow get back home. And so we had these horrible episodes of people trying desperately, walking hundreds of kilometers. They were forced to walk in the hot sun because even after the lockdowns were lifted, curfews were imposed from 7 to 7. So they couldn't walk in the evenings when it was cooler. In the maximum heat of summer, they had to walk in the middle of the day. Lots of deaths, at least 600 deaths of migrants counted along that period, and of course, innumerable others. And then what happens is that you go back and spread the disease in rural areas without infrastructure. The poor macroeconomic response also meant that even when the opening up started, and it started from July because there was no option, you would have the whole country dying. When the restrictions were lifted, there were not enough jobs available. So job recovery, even when it happened, it was happening at half the wages that people were getting earlier. There was really, even when you got a job, you got it at half of what you were earning earlier, on average. This is the average impact on wages. And so you can imagine the impact on the self-employed who rely on, selling little goods and services to other people. They have still been devastated. They are still utterly devastated. We have approximately 300,000 small enterprises closing every week over the last few months. The other aspect of this is that, India is really good at social distancing, by which I mean discrimination, hierarchy, exclusion, all of the things that the caste system has ingrained in us. And the social distancing of the COVID really entrenched this. It brought out all the worst prejudices. And Anu can tell you more about how it affected, attitudes to Muslims, attitudes to lower castes, attitudes to, it was seen as Chinese virus. So Northeastern people who have certain ethnic characteristics were ill-treated in other parts of the country. I mean, extraordinary displays of prejudice that added to the sort of tragedies that were befalling the country. Then we have, because of this already weak economic situation and because of a complete overconfidence of the government in terms of its own ability to control the disease, because we had a decline in the infection rates, which nobody has still adequately explained, we have a massive second wave, utterly devastating. And this second wave, in a way, it's still continuing because it has spread to the rural areas extensively, and we do not have data for the rural areas. The journalists who go there come back with horrifying stories and undercounting of, sometimes thousands of times of undercounting, because we don't have those facilities to even test for whether someone is COVID or not. Death certificates, routinely cause of death is given as illness, which could be anything. And as I said, lots of people die without getting death certificates or registrations. So we really don't know the extent to which it is continuing to devastate the poor, especially in rural India. But all of this has been made worse by one thing that we thought India could do properly, which is vaccination. India has a very strong history of vaccination. We have had a very good and effective universal immunization strategy. universal child immunization, etc. It was door-to-door delivery of vaccinations, and it was universally free. We also produce vaccines. The largest vaccine producer in the world is based in Mumbai. We supply 60% of UNICEF's global requirements. We export vaccines. So everybody assumed that at least our vaccination would work and would be all right. Turns out no, because this also the government basically messed up. With its completely confused, changing and privatizing, commercializing vaccination policy, it has destroyed a really good universal immunization system. It first did not even order enough vaccines from the central government to actually meet India's requirements. So it gave orders in March this year, which means it will take much, much longer to actually. Then it was bragging about how India is exporting vaccines, but when it realized that the second wave has happened and we need to vaccinate, it hadn't planned for vaccinating the whole population. It suddenly stopped the exports. So COVAX, a global facility which is supposed to also deliver vaccines to poor countries, was relying on these Indian exports. It was left in a mess. Our neighbors in Nepal and Bangladesh, who were relying on these exports, they were left in a mess. They got one dose and then they were not getting the second dose of the vaccine. So extraordinary mess created there. Then the central government said, we are only going to provide 30 million doses, 60 for 30 million people. The rest of it state governments can do. And 25% the private sector can do. And you can go and pay. And you can go and pay any amount. The private sector will charge you. Now, state governments, no country in the world makes provincial or state governments buy vaccines. You can't do it. First of all, you have to be in there fighting for your share of vaccines in a global marketplace, which has gone crazy, which is a seller's market, because there are not enough vaccine supplies to meet the needs. And so they're charging all kinds of crazy prices. And anyway, they have books, they have orders already till 2022. But also state governments cannot provide legal indemnity. Remember, none of these vaccines is properly authorized. They're all emergency authorization. So if anything happens, the vaccine makers are demanding a legal indemnity that they will not be held responsible. State governments cannot do that. It has to be the central government. So we had another 6 weeks wasted with this terrible policy, which created a complete mess. And now the central government has had to take it over again. But again, we are short of supplies. So all they're concerned about, they will do something like a big propaganda attempt to have the most vaccinations done anywhere in the world in one day. So they hold out and don't vaccinate for a week beforehand and then do all the vaccinations in one day, so they can do 8 million vaccinations in one day and create a world record. They did that, and now again, the vaccination rate has fallen because they used up all the vaccines. Now again, there's not enough. So we have still not vaccinated fully. We've just vaccinated 3% of our population fully, and about 12% with one dose, which is nowhere near what we need. In the middle of all this economic and health mess, all the other health conditions, which I haven't mentioned, have got worse because, people with TB are not getting treated, people with cancer are not getting treated, women can't go to hospitals for deliveries. It's a mess. But this is when the government has energy not to do any of the things it's supposed to do, but to bring in very anti-people laws. A farmer's law, which would really deprive farmers of any kind of protection and throw them at the mercy of national and international agribusiness. Labor codes that would deny labor even the few rights that they have, that small 5 to 8% of the labor force, that workforce that actually gets some rights, even those would be denied. Environmental deregulation, massive suppression of dissenters, arrests of students, of activists, of lawyers, of professors, across the board attempts to suppress dissent. And of course, a major enrichment of cronies. We all know that COVID-19 has accelerated inequalities of wealth and income, but India is the sharpest example of this. We have devastation in the material conditions of 90% of the people. But the richest group has got so rich that we have added 500 people to the Forbes list of billionaires in this 1 year. And two of the richest cronies, Mr. Ambani and Mr. Adani, have jumped up in the global wealth list. Mr. Adani, who is Modi's special crony from Gujarat, has jumped up 55 positions because he has, I think his income, his wealth has gone up by 15 times. And Mr. Ambani, poor fellow, his has only gone up by 40%. But he was already in the top 10 richest people in the world, so he can manage. Essentially, what I'm saying is that there are multiple reasons for protest, even in a population that has been so battered by economic and political, multiple kinds of protests, multiple kinds of attack. Nonetheless, we are finding that there is still protest because conditions have become so bad that the attempts to distract everybody by using, Hindu, Muslim, religion, caste, all these backward, revanchist kinds of things, they are for once a little bit less effective.